Hi, my name is Jordan Mitchell, and this is my final project on what it takes to be a nurse practitioner. What is a nurse practitioner? Their main role is to prescribe medications, examine, diagnose, and treat illnesses independently. In 20 states, nurse practitioners have a full practice authority, which means that they do not have to work directly under a physician. In those states, most of the time, the nurse practitioner works as a primary care provider with their own patients. But for the other 30 states, they can practice all of the same responsibilities. They are just required to get it signed off by a physician on certain decisions that are made for that particular patient. The common duties for a nurse practitioner are general and preventative care, conducting checkups, diagnose and treat illnesses, order labs, tests such as EKG or x rays, and prescribe medications for children and adults. They also help to manage their patients' health and design treatment plans. But depending on your specialty, your responsibilities can vary. If you are a primary care nurse practitioner, you work as a generalist who works in family health clinics or hospitals. If you are a pediatric nurse practitioner, work in consultants with doctors in a children's ward treating children from birth to the age of 18. In some work situations, pediatric nurse practitioners maintain their own patients and make decisions based off treatment. If you are a geriatric nurse practitioner, you do care, treatment, and consulting for elderly patients and their families. The work setting for a nurse practitioner can vary. They have many different locations where they can work: hospitals, nursing homes, or other primary care offices. The first step to becoming a nurse practitioner is receiving your bachelor's in science of nursing, or your BSN, which usually takes about 4 years. Next thing you have to get is a registered nursing degree or your RN and maintain good standings while working. The next step is starting a master's program of nursing, which usually takes about 2 years to complete. Once that has been completed, you must receive an advanced practice nursing license in practical nursing. Depending on what state you live in, depends on what exams and certifications are needed to move forward in the career. There are 5 different nurse practitioner certification boards in the United States. These include the ANCC, which is for geriatric, primary and acute care, family care, pediatric primary care, and psychiatric mental health. PNCB is for pediatric primary and acute care. The NCC is for neonatal care and women's health care. The AANPCP is for family and geriatric primary care, along with AACN, which is also for geriatric acute care. For my 5-year career plan to becoming a nurse practitioner, I will graduate this May from the University of South Florida with my degree in health science. From June to September, my plan is to take the time to research accredited nursing programs that will be the best place for me to go to receive my BSN. I plan to start in January of 2020 by getting accepted into an accelerated nursing program and start classes and the clinicals that I need to take for this program. January 2020 to December 2022, I will complete the nursing program and prepare to take the NCLEX. In December of 2022, after I've completed and passed the NCLEX, I will apply for a master's program to begin the process of becoming a nurse practitioner. In January of 2023, I will start the master's program at an accredited nurse practitioner program. In December of 2025, I will graduate from the master's program and prepare to take the boards and certification exams that I need to continue. In April of 2026, I will begin working as a nurse practitioner at a primary care office once I have completed all of the things that I need to do. to start practicing. Thank you so much for watching my presentation.